Digital devices to measure blood pressure have become commonly used in the general population due to the ease of handling. Currently, patients often ask their doctor about normal pressure levels. The answer is 120 over 90 millimeters of mercury, and then they are left with the idea that if they're outside these figures, they have bad pressure, and the problem is that on many occasions they improperly self-medicate to the detriment of their health. Let's clear this up. Indeed, the average number of normal blood pressure in an adult is 120 over 90 millimeters of mercury, but this can vary throughout the day within a range of approximately 10 millimeters of mercury up or down. Under normal conditions, the pressure usually begins to rise a few hours before the person wakes up in the morning and reaches its maximum peak at noon. Then it usually goes down in late afternoon and decreases more at night during sleep. Now, there are also situations that can temporarily raise blood pressure. For example, doing physical exercise, experiencing pain, intense emotions, or fear, having a very heavy day at work, and even in some people, their blood pressure increases by being in front of the doctor. There are also some medications that can temporarily raise blood pressure, such as non-steroidal anti-inflammatory drugs, some antidepressants, corticosteroids, hormonal contraceptives, caffeine, and certain herbal supplements such as arnica, ephedra, ginseng, and licorice, among others. There's a large number of people who don't know that they have high blood pressure, since the condition is not always accompanied by warning signs or symptoms. In some cases, discomfort such as headache in the morning, nosebleeds, visual disturbances, and ringing in the ears could occur. But beware, in severe high blood pressure, which is potentially lethal, there may be tiredness, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. On the other hand, there are also situations that can temporarily lower blood pressure. For example, prolonged exposure to heat and taking medications such as diuretics, drugs for Parkinson's disease, and certain products for erectile dysfunction. Blood pressure is considered low when it's less than 90 over 60 millimeters of mercury. Symptoms of dangerously low blood pressure include dizziness, nausea, and fainting. Due to the aforementioned, it's very important to take your blood pressure periodically, but to obtain a correct measurement, it's recommended to be relaxed, have had at least half an hour of previous rest, don't register it just after having taken food, coffee, or tea. Be seated comfortably with your back supported and your feet touching the ground. The arm should be bare and placed more or less at the height of the heart. Have an empty bladder and don't be talking during the measurement. Now take note. To establish the diagnosis of arterial hypertension with certainty and have the basis for starting treatment, it's recommended to take measurements twice a day at different times for a month and always or almost always find figures above 140 over 90 millimeters of mercury. Blood pressure is classified as normal if it's less than 120 over 80 millimeters of mercury. Prehypertension 120 to 139 over 80 to 89 millimeters of mercury. HBP grade 1 140 to 159 over 90 to 99 millimeters of mercury. HBP grade 2 160 to 180 over 100 to 109 millimeters of mercury. HBP grade 3 180 to 209 over 110 to 119 millimeters of mercury, and grade 4 hypertension above 210 over 120 millimeters of mercury. If after having done the above, the condition of hypertension is confirmed, treatment should be started. the ideal objective of which will be to maintain figures below 140/90 millimeters of mercury. This treatment includes lifestyle, natural remedies, and drugs. That lifestyle includes diet low in salt and fat, eliminate excessive body weight, perform physical exercise, for example, walk daily for about 15 to 30 minutes, no smoking, and moderate or suppress the consumption of alcohol, coffee, and dark sodas. Now let's see the top 5 natural home remedies for blood pressure treatment. 1. Garlic water. The ingredients to prepare this formula are 1 raw garlic clove peeled and crushed, and 100 milliliters of water. Its preparation consists of putting the garlic in a container with water in the afternoon, letting the formula rest at night, and drinking it the next morning before or after breakfast. 2. Lemon juice and coconut water. To prepare this remedy requires the use of 2 lemons and a cup of coconut water equivalent to 250 milliliters. Its preparation is simple. Simply mix the ingredients and that's it. It's recommended to drink the preparation daily in the morning. 3. Canary seed tea. The required ingredients are 1 tablespoon of canary seed, 1 piece of cinnamon, and 2 cups of water equivalent to 500 milliliters. These components are placed in a pot and boiled for 5 minutes. Then the pot is covered, its content is left to rest for 10 minutes, it's passed through a sieve, and that's it. It's recommended to drink a cup in the morning and another in the afternoon. 4. Jamaica flower tea. The ingredients required to prepare this remedy are 2 tablespoons of dried Jamaica flowers and 2 cups of water. To prepare this formula, the Jamaica must be placed in boiling water. Then the infusion is left to stand until lukewarm, strained, and that's it. 1 cup should be drunk every 12 to 24 hours. If desired, it can be sweetened with honey to taste. And 5. Blueberry juice. To prepare this juice, you will need 1 cup of blueberries, 150 milliliters of water, and the use of half a lemon. All the ingredients must be blended until a homogeneous mixture is obtained. Pass through a medium strainer, and that's it. It's recommended to drink this preparation 1 to 2 times a day. Now, within allopathic medicine, there are also excellent medications for the control of high blood pressure at different levels. In prehypertensive patients, treatment consists of lifestyle changes as explained above. This process is even more effective if combined with any of the home remedies already described. In patients with grade 1 or 2 arterial hypertension, it's recommended to start treatment with a single drug. The best option is a beta blocker or a diuretic. The beta blockers of choice are metoprolol and atenolol, and the first-line diuretics are hydrochlorothiazide and chlorthalidone. When taking a single drug is insufficient, beta blockers can be combined with other antihypertensives such as diuretics, angiotensin-converting enzyme inhibitors, and angiotensin II receptor antagonists. To date, diuretics are, along with beta blockers, the only groups that have shown significant reductions in cardiovascular and cerebrovascular morbidity and mortality secondary to hypertension in long-term follow-up studies. Therefore, they remain the agents of first choice. However, it will always be the treating physician who determines the specificity of the medications. However, patients with grade 3 arterial hypertension require the use of various drugs to achieve control. In these cases, it is preferred to start treatment with beta blockers and thiazide and potassium-sparing diuretics. If effective control of blood pressure figures is not achieved, an ACE inhibitor can be added, or alternatively, try one of the following modalities based on 3 drugs: A. Diuretic, ACEI, or ARB and calcium antagonist, B. Diuretic ACEI or ARB and beta blocker or alpha blocker, C. Diuretic, beta blocker, and dihydropyridine calcium antagonist, for example, flodipine, D. Diuretic, calcium antagonist, and alpha blocker, and E. Diuretic, beta blocker, and hydralazine. Finally, severe arterial hypertension, that is grade 4, constitutes a hypertensive emergency for which its treatment requires hospitalization and immediate specialized therapy. Important: it should be emphasized that all hypertensive patients should regularly visit a doctor to verify good blood pressure control, heart conditions, and cholesterol and triglyceride levels.